A very warm good afternoon to everyone, and I would like to welcome you all for an amazing power-packed session with all women in charge today on this panel. So we definitely can say that she rocks. I heard this yesterday, and here we are. So I know it's tough to be attentive and awake, especially post-lunch, but we will all try and ensure that we have a very productive session and also discussion. I would just like to take a minute to introduce myself. I'm Dr. Tarang. I'm the Group CEO for all the Reliance Healthcare initiatives way down in India, and also the CEO for Sir H.N. Reliance Foundation Hospital in Mumbai. And would look forward to, if any one of you ever wants to or will be visiting Mumbai, would like to invite everyone to come and visit our hospital. I'm also joined by 4 powerful speakers here, and I'll introduce them as we go along. I request you all to please put your mobile phones on silent mode. Every speaker here will present one at a time. We have around 8 to 10 minutes every speaker. I will remind you all after the end of 8 or 9 minutes. If any one of you wishes to learn more about me and our speakers here today, please visit their profiles, our profiles on the app of the Congress. And if you need any simultaneous translation, please scan the QR codes near the door using your mobile device. Kindly use earphones so that the others are not disturbed. This total session is for 60 minutes, and I'll try and make it as compact as possible. How do we go about it? We have each speaker coming up, sharing the details about the topic that they have gone in depth. And after that, the next part of the session will have discussion with me and the speakers. And then we will open it to all of you for questions, and finally conclude and bring out some of the important learnings from the session. As we all know, precision has been the mainstay of healthcare. The next leap will be delivering precision at scale by leveraging digital ecosystem. As we all know, the latest McKinsey report in 2024 says that traditional machine learning and deep learning could actually unlock $360 billion in net healthcare savings while delivering the intended consequences of equity, efficiency, ease of access. But are the healthcare systems investing to capture these opportunities? Our discussion today will explore both the technological and cultural aspects that build a culture of innovation. I am indeed delighted to be joined by our 4 distinguished leaders who each represent different facets of that change, from nursing to oncology to national policy and institutional leadership. Together, they bring perspective to go beyond technology into the mindset that sustains innovation. This brings us to our first presentation by Dr. Sumaya Albushi. She will speak on leadership's impact on accelerating digital transformation. Her session highlights how visionary nursing leadership has redefined data culture across the Emirates Health Services by embedding governance, standardization, and sustainability within every layer of nursing practice. Dr. Sumaya is the president of Emirates Nursing Association and director for Nursing Department in Emirates Health Services. Welcome, Dr. Sumaya.
So good afternoon, everyone. Thank you very much for your commitment. Usually the sessions after the lunch are the worst timing, I think, because everyone will feel like to go to sleep. Again, it's an honor to be with all of you as a visionary leaders for our health system. And my story is going to show you how nursing leadership started to transform the digital and data-driven care in Emirates Health Services. I think since we have short time, it's not working. Should I show it here? No, it's not working. Can someone help us to? Okay. So in order to understand, because I'm working at Emirates Health Services, we are a health facility with 134 health facility in total. We have 17 hospitals, and total beds are 2,542, 70 primary healthcare center, and total employees are 11, and we call them our talents, 11,522. And all of us know, or if you don't know, that UAE rank among top 10 globally for digital government readiness. And this is what you see in the screen as the strategy of UAE for digital readiness. So this is the roadmap for the digital. And if you see the dimension that they are talking about, proactiveness, we would like to be proactive instead of being reactive to numbers, leaving no one behind, because we want to make sure that equity is provided to all our patients and employees. It's fit for the digital age. All the age generation, they have to understand about the data and what's the story behind each data. And then digital by design, we want to make it a suitable, comfortable design to all our patients and help. And then data-driven decisions are taken from this. If you see in the right side of the screen, we have at the national level, at the Emirates Nursing Association also, a national campaign for informatics to grow. And those are the champions to make the nurses transform at the digital and data-driven curve. Now, what we did at Emirates Health Services, based on what I talked about, the national strategy for United Arab Emirates, as well as the Emirates Nursing Association. So at Emirates Health Services, we, as a visionary, tried to redefine the data culture. We wanted to shift the mindset across the Emirates by embedding a framework, which is, first of all, the governance, standardization, and sustainability within every layer of nursing practice. What we want to shift the nurses' mindset, the importance of data. We need them to read the story behind those data. We shifted from manual data collection to Excels, and then we moved to enterprise nursing dashboard, starting from the framework, which are the governance, as I said, the standardization, and sustainability. Now, what you see in the screen is we try to understand, to make the nurses, without being transparent and making them to understand the data across EHS. Governance is very important. Nurses has to own the data ethically and understand how the data are driven and how they are governed. So we did a centralized dashboard that's coming down from bottom to up. It's not from the top to down. Because the one who's feeding our system, all our frontline, we want to make sure they understand the data. So within this dashboard, we didn't want to show them just the patient's outcome, but it's the workforce outcome, and then the professional development outcomes, and then the clinical outcome, which is the nursing quality system. Because you won't be able to reach the quality system without understanding the complexity of the workforce and how we are going to utilize them in order to enhance our efficiencies. Because a study has shown when the nurses are engaged at the front line, you are going to increase their performance 2.4 times from their previous performance. So this dashboard is centrally accessible to the frontline staff. They will understand, because the study shows when nurses see the live data and they see that they reduce the fall, for example, by 20%, if they reduce by 30%, that's going to empower them and make them understand. We cannot come at the end of the year and tell them your data or your statistic or your KPI are going to be, or they are downs, and you need to explain or justify. They have to own this data. They have to manipulate, to mimic those data, to clean them and understand them. And because most of the time, the data that are owned by the nurses could make decisions for the patients when they are unable to tell us the story. Data will tell us those stories. Therefore, we need to understand those data. So if you see, this is the nursing quality dashboard, where we look to clinical, managerial, and operational KPI. I do understand many of you will ask, so what, it's a dashboard, so everyone has a dashboard. But the importance of this dashboard is the cultural change, the mindset that we did for the nurses. It's not to think about one aspect, because nurses are the largest workforce, and they are 50% of our health workforce. And we have teams within the nursing also, because there is a team of quality, there is a team of workforce, and there are a team who are concerned about training and professional development. You need to integrate them together as one team, and then they have to be as one team with interprofessional collaboration. Because it's not only in nurses in silo or other healthcare, but we need to make them understand the mindset shift has been done for all the nurses in order to understand the data and how we are going to use them. Therefore, we have an informatics teams, and there are champions for those informatics teams. The champion's job is to cut the, to bridge the gap between the clinical bedside nurses and the data. And they are the ones who are going to lead, so we invested on them. They were trained, and there's a big group at the national level as well as at Emirate Health Services for each health facility, and they have their own career path to make those dashboards live for all our nurses. Then we moved, after making sure from the governance of the data, we went to data-driven transformation, which is the standardizations. And as I show you, EHS has multi-health facilities, and we need to understand and to define those KPIs or those data to having a unified language with our nurses. I see the time is running. So that's the standardization, where we have a systemic oversight for the nursing quality and system-wide standardizations. So systemic oversight to establish, it is established to ensure the transparency, accuracy, and compliance across all data processes. Nursing quality system, there is a centralized approach has been developed to ensure data consistency facilitates real-time performance, and that's what our aim is. Not to wait end of the quarter, but we need a real-time performance for our nurses to understand, and then go to system-wide standardization. Now, it is very important that we work many times on initiatives, but we don't think how sustainability is important and how we are going to make those data sustainable and help them to take those decisions. So we have to make sure the pillars of sustainability and data strategy, because that will impact the workforce, the environmental, where the digital transformation and green impact, because no more paper is going to be used, and financial cost efficiency and productive forecasting. And we are at the stage of making sure after from those quality of data to move to nurse-led AI data decision. Because we understand in order to move to AI stage with the data, the quality of data very much important. Now, the EHS nursing data-driven projects that we did work on, nursing quality system, the documentation compliance monitoring dashboard. We understand how nurses document with the patient because it's for their safety, for the medical liability, visual audit dashboard. And we have nursing transition to practice program, because we understand that one of the sustainability of this to make sure from the new generation of the nurses who come in and make them understand how the transition to practice is going to work. So this is the centralized part of the KPI to show you an example. And this is how compliance monitoring dashboard will be shown to the nurses at all levels at each health facility. And these are the visual audits that we use, and with over 40,000 audits happening across the facility in each month, because it's so easy, just barcode scan and check the compliance example for the hand washing. And also, there is a good collaboration between the quality and infection control department with the nurses to do this data-driven shift and introduce an audit for the infection-related KPI. Transition to practice, as I said, again, a part of empowering our next generation of nurses. We do have those data, and they are accredited also by ANCC. A lot of studies are going for all our new graduates to make them a real competent from novice to expert to save the patients in a better way. Therefore, the empowered outcome, so this insight of leadership has allowed us to move to the next step. Then in order to have a better outcome, we had the unified reporting culture. We did all the nurses and midwives are able to do data interpretation. And of course, this will enhance a lot of efficiencies at the bedside. Thank you very much. I could not elaborate much more on the system, but I'm ready to answer any of your questions.
Thank you. Thank you so much. Globally, the digital health market is estimated at roughly 230 to 250 billion US dollars in 2023, and it's projected to grow to 500 to 600 billion dollars in 2028, which is an accumulated growth rate of 18.6%. With this, I would like to now welcome Mrs. Sophie, who is the CEO for the France Cancer Care. I would like to invite you here, and in view of time, I leave your introduction for us to explore on the app. Please, Mrs. Sophie, would like to hear from you.
Good afternoon, everyone. I am going to present you strategies for data-driven cancer centers for better care pathways. Unicancer is at once a network of 20 non-profit hospitals specializing in cancer care. We are a major player in cancer research. For example, we are the first academic sponsor of oncology trials in Europe, with 30% of French publications in oncology at an international level. All our centers are based on a unique comprehensive cancer center model, an integrated organization with a clear central governance covering cancer care, research, and education. Our model is a relevant response to the new challenges in oncology thanks to a high level of specialization, a strong integration in international networks, an extensive range of high quality cancer diagnostics and care, and we are operating under a medical scientific governance model, flexibility for swift decision making. We are developing a Unicancer data and AI strategy. This strategy is based on the use of health data, so as to generate health data can be used to generate a huge amount of information, which is sometimes structured, but varies depending on the tools used. They come from many different sources: users, systems, healthcare professionals, suppliers, partners. The expected uses of these data are numerous: research, statistics, health data warehouses, AI. And the types of data are numerous too: data and production tools, data collected from patients with PROMs and PREMs, clinical data, omics data, medical imaging. That's why the use of health data, particularly real-life data, meets two key objectives for Unicancer and the CLCCs: addressing the continuum of care from prevention to post-cancer care, including diagnosis and the development of innovation, developing the 5P medicine: personalized, predictive, evidence-based, participatory, and patient-centered. And the exponential growth in the volume of health data requires the development of powerful digital tools to exploit it, tools that rely in particular on AI. In public health, to develop, to better understand the epidemiology of cancer, for example; in research, to develop new research methodologies; in healthcare organization, to improve the efficiency of healthcare facility management; in terms of medico-economic and therapeutic evaluations, using real-life data to evaluate the effectiveness of treatments, improve therapeutic strategies, and identify areas for optimizing healthcare spending in a constrained budgetary context. Ensuring the quality and reliability of real-life oncology data is a challenge. As soon as the data is collected, We must work on the data quality assessment, data harmonization, and analytical review of data, validation of results, internal audit, and we must organize an external assessment, external audit of the quality management system and quality procedures. There are several distinct purposes for the practical application of AI in healthcare. Different areas of performance, medical imaging analysis, diagnostic, areas for improvement and development, clinic workflow management, organization of care, difficulty in modeling complex organization, diversity of practices, and caregiver-patient interaction, importance of trust, human relationships, acceptability of AI solutions. Research on health data, particularly real-world data, is of fundamental importance in accelerating the fight against cancer. In the field of screening and diagnosis, optimization of treatment, prediction of clinical events, genomic analysis and treatment personalization, patient follow-up and telemedicine, surgical and robotic assistance, for example, or drug research and discovery. Generative AI allows to produce new artificial data from training data. It can be particularly useful in care and research with a wide range of applications. To illustrate my point, I will give you 2 examples from healthcare and research. In healthcare, generative AI can be useful in medical imaging to obtain images with better resolution, less background noise or fewer errors, thereby improving diagnostic and care quality. In research, generative AI can be useful in pharmacology as it allows a faster examination of new hypotheses or an optimization of existing molecules. Despite its wide range of application and significant potential, generative AI faces many challenges that need to be addressed. Dependence on training data, quality, reliability, diversity, need for human supervision and ethical safeguards, issues of sovereignty, education, and risk management, for example. AI applications are undergoing spectacular development and transforming our societies. However, the widespread use of generative tools in healthcare raises several challenges in regulatory, technical, methodological, HR and organizational, ethics and sociocultural, economic and environmental fields. And evaluating AI in healthcare requires continuous validation of any changes to the model, its environment, or the target population. In the design and purpose phase, during analytical validation, clinical validation, and it needs a continuous monitoring. The development of AI calls for the deployment of an appropriate legal framework to regulate its use and ensure the protection of its stakeholders and users. In Europe, this framework articulates around 3 main texts: the GDPR, General Data Protection Regulation. The AI Act is the first ever legal framework on AI in Europe, which aims to promote the responsible development and deployment of AI in the EU, and the European health data space imposes specific obligations regarding health data and is the EU's first common data space dedicated to a specific sector. The benefits of AI in ecology are numerous, both in care and research. Training AI models, improved precision and personalization of treatments, anticipating rare situations by taking exceptions into account. AI models are more robust to real-world variations and contingencies, adjusting models, assistance with patient identification and selection, and new methodologies using AI. We are leading some flagship programs and some real-world data flagship programs. And for example, we have OncoDS. It's a federated health data infrastructure interlinking the local data warehouses of our comprehensive cancer centers. I can take the example to of CANTO, which is a prospective cohort dedicated to research questions regarding survival after breast cancer. We are spearheading research programs that are gaining momentum in partnership with a lot of industrial partners in the different fields you can see at the screen: translational research, clinical research, real-world data and AI, medical imaging, security and training, and telemedicine. And I think
Okay, great. Thank you.
I've in my,
Right on the dot.
my presentation, maybe a take-home message: deployment of digital technologies and AI in healthcare is entering a phase of rapid acceleration, marked by the growing number of operational use cases. In oncology, this innovation hold great promise for improving diagnosis, treatment, planning, and patient follow-up. However, human oversight remains essential to ensure appropriate regulation and ethical use. Thank you.
Thank you so much, Mrs. Sophie. It was wonderful. Now let us welcome our next speaker, Dr. Laila McKay. She would like to share her perspective on innovation in policy and practice enabling digital transformations across the National Health Service in UK. She will share the macro-level levers, policy, regulation, funding, government that enable digital and data-driven care at national scale and the lessons for hospital systems and large operators. Dr. Laila is Director of Policy at NHS, Executive Lead of the UK's Health and Care LGBTQ+ Leaders Network, and author of the Breaking the Rainbow Ceiling. A big round of applause, Dr. Laila.
Hello, everyone. So yes, today I'm going to be talking about the NHS specifically in England. The NHS covers the whole of the United Kingdom, but they operate slightly differently. And within the population that I'm talking about, the NHS sees 1 million patients every day. It has 1.5 million staff members, and it spends about 150 billion in public money. So it is a huge focus and concern of the whole population, of all the politicians. And I think that what is interesting here is that we have recently had a new government, about just over a year ago, and they have brought in a 10-year plan for the NHS. In fact, wider than the NHS, for health in England. And this 10-year plan, oops, am I going the right way? Oh, that's weird. And this 10-year plan has 3 big ambitions. The whole 10-year plan is around how to move from hospital to community, how to move from treatment to prevention, and underpinning all these things, how to move from analog to digital. So we hear this chat every day: change from analog to digital. It's the great ambition, and it is what the government is depending on to bring the NHS into the future. We have many challenges, of course, as we have been hearing all week about all of your challenges: the aging population, financial unsustainability, the need to integrate services. And our government is very focused on the fact that this relies on digital. But at the same time, it's a bit of a tricky situation, because we don't have a great deal of money. We're still recovering from COVID. We are trying very hard to do things that are politically urgent, like reducing waiting lists, like improving urgent and emergency care. But at the same time, we are trying to save money, and at the same time, we are trying to transform. Here's just some of the things about the 10-year health plan. But yes, digital transformation. is super challenging. To understand what we're trying to do, think about the NHS as a federation of lots of hundreds, maybe even thousands of organisations, depending on how you cut it, and they all operate with a degree of independence. So this is not like a big company that can just implement digital transformation across it. Everybody is doing their own thing. They've all started doing it to different timelines. They have all procured different digital solutions. Some of them haven't even really managed to get an electronic patient record yet. Others are very far advanced, but most of those systems are not interoperable. We have primary care systems with completely different digital systems to secondary care. Again, they may not talk to social care, they may not talk to hospices. So with this ambition to be more integrated and work in a patient-first way across neighbourhoods and across places, then actually these different levels of digital transformation and those different investment procurement decisions have created all sorts of chaos. We may come up with a technical solution that will work very well in some parts of the country, but in other parts, we've got all these legacy systems, we've got outdated IT infrastructure, different decisions about procurement come back to bite us at later stages. And yeah, there is a lot about NHS IT that is pretty outdated right now. And what do we actually want? A digitally mature NHS that has a high degree of being data-driven, of being interoperable, and of enabling us to use population health management in a way that can genuinely enable us to be prevention first. But to get there, we're going to need two things. One is structural reforms. And I was like, what's the other one? And the other one really is an acceptance that actually digital systems are forever improving and evolving, and we need to not become too obsessed with what is the specific tech that we have procured, but more what is the long-term sustainable digital systems that we can design. So what are our challenges right now? I've got some of them up here. Capital and revenue funding, it really does limit our ability to invest in tech and other digital things and transform care. Lots of anxiety about who owns the functions. The 10-year plan changed some of the infrastructure of the NHS. So who is actually responsible for digital, and what parts of digital, what parts of data are people actually responsible for? It is evolving, and that has some significance for decisions that are made. Workforce is a real issue, as we heard from the other speakers, in terms of capacity and capability. As I said, there's all sorts of data systems, very little interoperability right now. Some of them are not of great quality. And quite often, digital transformation is seen as a digital project rather than a wider leadership project. So quite often, the digital teams will be trying to implement something, whereas actually, to make it work properly, the whole hospital, the whole healthcare system needs to understand what they're trying to achieve and work together across the clinical, the management, the digital systems, and others to make it work. It doesn't always happen right now. Innovation is very variable in the uptake with a very wide range of maturity. We're all using different tools, and ultimately, there's so much going on. There's so much need to save money at the moment. There's many redundancies. There's a lot of focus on change at the moment, and that can make it really difficult to get into innovation. The UK is particularly excited by AI. The politicians have cited it as one of the big bets of the 10-year plan, so they're very much hoping that AI is going to cause the answer to many of the challenges that the UK has. So it's worrying and exciting at the same time, isn't it? But there's a commitment that from 2027 we will have validated diagnostic and administrative AI tools rolled out across the NHS, which is actually quite ambitious when you've just heard about the variation that exists in digital maturity. So from next year, we're undertaking a framework procurement process that all NHS organisations can use to enable us to adopt AI safely. And some of those tenders have already started. From 2027, we're going to be rolling out these tools, supported by guidance from the centre, so from the government. And what's interesting, the NHS is developing a strategic roadmap for AI, which is, we've brought together 10,000 NHS staff all across the whole country who have a particular interest in AI, and together they are developing the roadmap. Mildly chaotic, but as you can imagine, it is quite an important thing because there is so much variation and understanding of what needs exist at local levels. This is going to enable this to happen. So that's quite exciting. And then, of course, from a regulatory perspective, we really need to get a grip on this. So we're just launching the National Commission on the Regulation of AI in Healthcare. What NHS leaders need and want? Well, they want us to start by thinking about digital transformation in terms of not what is the technology, but what is the problem that we're trying to solve, and what evidence do we have that the things that we decide to do are actually going to solve that problem. We want to really focus on not digitizing for the sake of it, digitization only where it is going to be helpful. Thinking about as I said, that collaborative leadership beyond an IT project. This is a whole system leadership challenge, and really building in continuous improvement. Very quickly, here's a case study of one of the hospital systems, Maidstone and Tunbridge Wells NHS Trust. They invested in an electronic bed management system to manage patient flow across their various sites. They've got 2 hospitals, a community hospital, 2 hospices. By doing this and creating a coordination centre with a dashboard that the administrative and clinical people were both able to see and input into, it's had really, really significant impact in this hospital system. What you've seen here, I've put up some of the results. Reducing allocation of beds from accident and emergency department time by 86%. That is always one of the barriers where people get stuck in A&E waiting for a bed, and that has ramifications on people who are waiting to get into A&E in ambulances, which of course has ramifications because then these ambulances cannot go and pick up other people. So improving the flow through the system has been the main impact here, but also really improving the speed by which people, once they're ready to be discharged, get out the door and get home, freeing up significant numbers of beds. So I think that these examples of projects where you implement a digital solution and you can really measure the benefits in terms of money, in terms of bed time, in terms of staff time, is one of the key things that really helps to build some support and win over both hearts and minds to why we're doing this and the benefits that are possible.
We're running out of time now.
I hear that I'm running out of time, so I will just finish off by saying that leadership really is key to achieving some of this. And right now, that is very much what we're focused on, because there's not that much money in the system, but there is a lot of will and a lot of determination, and really focusing on what you're trying to achieve and not getting too distracted by everything that is shiny and tempting is where we're putting our bets for now. Thank you.
Thank you so much. Nursing leadership often sits at the intersection of clinical practice, operations, and digital tools. Nursing workforce forms the backbone of the large, complex organization. And with this, we would like to now welcome Mrs. Jessica to speak about implementing the Chief Nurse Officer role at Sahlgrenska University Hospital, enhancing leadership in patient care. She will provide us with insights into how nursing leadership role at Sahlgrenska has been structured to drive patient care, innovation, integrate technology, and also help in digital transformation. Over to you.
Thank you for inviting me to speak at this conference. I'm really happy to be here. I'm the first person to hold the Chief Nurse Officer role at Sahlgrenska University Hospital. In Sweden, we have 7 university hospitals, and only 3 of them do have the Chief Nurse Officer role. So we must ensure that the nursing perspective is present where the decisions are made. This is the key to developing healthcare and meeting the future challenges. But first of all, I want to give you a context of where I'm leading. At Sahlgrenska, we have 370,000 patients every year. We have 1.4 million patient visits, and we have 66,000 different interventions. The number of staffs are 70,400, and half of them are nurses and assistant nurses. I'm a nurse by profession. In the clinic, I'm a neonatal intensive care nurse, and I get my motivation from being a nurse, both in my leadership and close to the patients. As we've heard from the other speakers, healthcare is complex and it faces big challenges. We need clear communication across care transition, and we need strong perspective, and that can help us and be supportive. So therefore we need a position at every level and at the executive level. With an aging population that we heard of all of these days and increasing demands, we need innovation and we need sustainability. To truly improve patient care, we must amplify the nurse's voice, those closest to the patient, so they can deliver safe, high quality, and person-centered care. I lead in a matrix structure supporting the line organization. And to be able to do that, I need to listen to people in the organization. We need to listen to their experiences, their challenges, and their ideas. The goal for me has been to build the trust and from there drive a meaningful change together. My job is to strengthen the nursing perspective, of course, but also the team-based work. We need all kinds of perspective to succeed with the transformation. I also think that we need new competences in our teams. So I've spent a lot of time in all kinds of units to listen and to learn, and as my boss say, to smell the place. That's a way of finding out the culture, to feel how it is at every ward. So what I've learned is that we need to support the first line managers, those leading closest to the patients. First line managers are crucial for driving innovation, skills development, and engagement within teams, and to have the courage to build new kind of teams. By supporting and developing these leaders, we create the condition for a safe and thriving work environment. So, one example of innovation is that we've introduced the AI-based motion monitoring to prevent falls. It's a small rudder sensor, and its AI analyzes how alert us when the patient is at risk to fall, so we can act before an accident actually happens. We're trying to make the technology also prevent pressure ulcers and support post-operation mobilization. This idea came from a staff member, a nurse, who saw a need, and now we're scaling it up across the region. The project is taking careful planning, collaboration, and evaluation, and it's already improving patient safety and freeing up nursing time for direct care. The technology is just the tools. The real impact comes from how we work differently. It's a culture journey that requires visible and engaged leadership. We must support managers and teams to build skills, confidence, and the mindset to adopt new ways of working. Only then we can truly benefit from digital innovation in healthcare. To build innovation from staff closest to the patients, we have an education program in innovation and technology. This builds a culture of innovation across the organization, driven by staff ideas and engagement, not just leadership decisions. So, we are seeing positive changes. We do see better communication, more engagement, and interest of professional development. But challenges remains, of course, especially in creating workplaces where staff want to stay and want to grow, both professionally and as persons. So, to prevent this, we're building clear career paths and competence ladders for both nurses and assistant nurses, so every nurse knows what's expected, what opportunities exist, and how they can contribute to improve care. I think nurses play a key role in making care person-centered. So we see the patient as part of the team, not just in their own care, but in helping developing healthcare itself. So for example, when we were introducing the AI-based motion monitoring, we included a patient representative in risk assessment to consider their perspective from the start. I think true innovation happens when we listen to and collaborate with patients at every level. Finally, I hope that the story has inspired you to challenge all structures and support your teams. I think together we can create a better and more sustainable healthcare system. So thank you.
Thank you so much. That was indeed insightful. So that brings me to the next part of the session. I have a question for you, Dr. Albushi. We heard from you about how at national level you are trying to bring transformation amongst the mindsets of the people. So my question is, how do you align the digital transformation initiatives with the soft aspects of culture? Mindset is something that you are working on. How do you get the change readiness in the large hospitals?
Thank you very much. Based on our experience at Emirates Health Services, what we try to do is to make the data being, not just reporting by the front line, but they have to tell us the story behind the data. Because once they understand what the meaning of this, what are the story behind, then it becomes part of their culture. There is no need to check the compliance even, because they are the one who's coming to understand why those data are important. And once they understand also that those data will tell them a story about their patients and the family and the community, without the patient can speak, because we have different type of patients and family engagements and many, many other aspects. So these type of things are going to make the cultural change and mindset shift in bigger organization, also make them to own the data. By putting a proper governance system and standardizing across system, and then giving them the ownership, and then giving them the accountability of this data, and then they are going to learn from that, and the cultural change is going to happen by that.
And you think the hospitals are ready for the change?
Yes, because since there is a national platform, so the leadership, there is a vision. So I think that vision has to be cascaded down. The only things we need to provide them with the tools that help them to go with. So in the United Arab Emirates, we know very well digital readiness is #1 important, but we needed to serve the patient in a better way. It's not the idea of being a technologically data-driven system, but to understand how they are going to guide us in terms of our strategy and operations and giving the best outcome to our community.
Great. Thank you. Mrs. Sophie, you spoke about subject which is very close to our hearts. I think the way the cancer is moving, I think there is nothing, no other disease can compete with it. In the world of oncology, variability in care is often significant. So what data-driven interventions delivered the strongest impact on standardizing the pathways or improving the outcomes at your institute?
I think we are facing with the use of data many challenges, and the first is how we can personalize treatments, but not only treatments, diagnosis and prevention. And I think it's a main challenge for us. And one of the second challenge is how we can change the methodology of clinical research, clinical trials. And so as to face these challenges, I think one key point is the training of our professionals. How we are able to develop training programs which allow our professionals to be very prepared so as to use AI, for example, AI tools, for example, for radiotherapy treatments to improve the treatments.
Perfect. So training of staff, precision oncology, and clinical trials is something that you bet on to improve the clinical outcomes. Fantastic. Dr. Laila, my question to you is that from a policy perspective, what are the most critical enablers and the most persistent barriers for digital transformation in national health systems such as yours?
Thank you. And I think the enablers and the barriers are the same thing, aren't they? Probably a big one is data interoperability. Investing in getting that right is so critical. And really within that, having a baseline electronic patient record of some kind that works across your system. I think a big one is, as we've heard, workforce in terms of both capacity and capability. IT infrastructure, just really understanding where all those accountabilities and other types of governance lie as well, and just finding a way to invest in that. And linked to that is long-term funding. Quite often we had like 1 year of funding and that doesn't work, but also understanding what type of funding you need, because quite often you can see that people envision IT as capital funding, whereas actually the more cloud-based systems come in, you really need to think about what revenue funding you need, and that caused us some challenges. And then I would just mention as well, cybersecurity. It's not going to be possible to absolutely guard against any cybersecurity risks. So actually, what is your plan for that, and how are you going to maintain services if any issue does arise, is a really important thing. And I would just end by saying engaging hearts and minds. Quite often, these ambitions can be thwarted when patients and the public don't understand or are not on board with ambitions, and indeed staff. So bringing everybody with you is a leadership challenge for politicians as much as it is for managers within healthcare systems.
Perfect. I think engaging hearts and minds is a key word for everything. Thank you. And Jessica, thank you for an enlightening perspective. Just want to know that how have you approached building the data literacy and digital tool adoption amongst your nursing staff, especially at the bedside?
Yeah, as I said, we have this education where they can improve the learning, but I also think that listening and really listening to the challenges and make structures where the ideas from the staff actually, as you said, its leadership actually can be used and listened to and to make it happen. I think that's a way of getting the curiosity and the will of doing changes. So we need to listen on every level and especially closest to the patients. And also, as I said, we need to do it together with the patient. And nurses, they really like to do it together with the patients. So patient involvement and patient partnership, I think that's one of the keys.
Perfect. So patient partnership and patient involvement. Thank you so much. And now, anyone in the audience for any questions before I do a rapid fire chat with all of them? Yes. Can we have the mic? Thank you. Any remarks, any perspectives, any questions?
Thank you. A question for Mrs. Beaupere. You briefly mentioned the use of AI, of data for predictive medicine. And could you please expand a little bit on that and where you see the biggest potential and challenges?
We are working several unique answer and the comprehensive concerns like Gustave Roussy or Curie are working on several programs concerning personalized medicine. It's your question. And the use of AI in personalized medicine. For example, maybe I can make a focus on a program which is developed with Hawking, which is specialized in AI, and we work on so as to use AI for anatomopathology, and so as to have some results who can help personalize personalized treatments with molecular biology too, and to develop programs which allows to be more personalized on diagnosis and treatments. I don't know if you want more details.
I was wondering if you use predictive medicine, you can anticipate based on certain vulnerability profiles, and you can anticipate the disease coming before it actually you have symptoms.
For example, we use AI with a program of liquid biopsies, for example. And yes, it's an example of how you can personalize the diagnosis and to have predictions for cancer cases, yes.
Thank you.
Thank you. Anyone else? Any questions? Any remarks? Any experience? Okay, good. So then I have some rapid fire questions for you ladies. My question to you, Dr. Albushi, is what's the one metric that you monitor every week to track digital care adoption? What's the one metric that you monitor every week to track digital care adoption?
I will check my staff well-being.
Oh, perfect. Super. Mrs. Sophia, what is the single biggest mindset change which is required in healthcare teams to truly embrace digital transformations?
What is the main change?
Mindset change that you
Mindset
think
change.
is required.
Mindset change. I think that two things. For example, in France, our health system is very organized with the importance of hospitals. And I think with AI, with digital transformation, we must be less centered on hospitals because the pathways of the patients are for oncology long-term pathways during several years, and with an importance of the home care so as we must be more open and hospitals and expert centers like comprehensive cancer centers I represent must work must more work with nurses and physicians who are near the patient, and we must develop more coordination of the pathways and its digital tools allow us to develop this coordination, and we must be less hospital-centered.
Okay. These are supposed to be rapid questions, so you need to give me quick line answers, one-line answers. Okay, so Ms. Jessica, which single digital or data tool has most surprised you with the impact?
Well, I think that using AI is surprising me every day because it helps a lot, but you need to be critical. So, yeah.
Okay, perfect. And to you, Laila, about our future. In 5 years, what will data-driven care look like in your health system?
Oh, I don't know, but
Let's guess it, and then we'll check after 5 years.
yeah, we don't know, but hopefully what it'll look like is proper interoperability where patients can genuinely point to the benefits of the system and understand why we're even doing this.
Perfect. Very well said. Very well said. So with this, I think we are almost here to conclude the session. Any last-minute questions from the audience? If not, then I would like to thank all the panelists for a lovely session that we had. I think what we need to take away from the session is that it is the winning the brains and hearts with the brain and the heart that will drive the change. And I think things have moved a lot in the digital and the data-driven world. 5 years back, we were all just learning about it. We were learning what is the big data lake, how to get the data, how to put the data. Now we are starting to use these tools, and 5 years from now, I think we all should, in our institutions, in our healthcare system, should work towards seeing the results of how we are able to get the results out of these implementations and make a difference, learn from each other. And I think this part of healthcare is going to be not only fun, but it will be very fast. So I personally feel that we should use this technology in a more deliberate manner as opposed to fail fast and break things approach, because that's what many of the startups favor. But I think we need to be a little wary of that, and we need to take a thoughtful decision as to how it is going to make an impact. And as our panelists have shared with us, not only the challenges, but how to monitor the outcomes. So I think lots of learnings, and let's implement it now. We've talked about AI a lot, digitization a lot, and now it's time to implement it and get the best benefit out of the AI and explore the power of generative AI. Thank you very much, all of you here, and thank you so much, the panelists. Thank you so much.